At the age of 17, my cousin Jennifer was diagnosed with Crohn's disease. Crohn's disease is a stomach inflammatory disease which causes a lot of pain, and it causes a lot of pain, and it has, when you eat, because your stomach is inflamed, it causes pain when you eat. It's hard to eat, you lose a lot of weight. At the age of 17, 5'2", she was 110 pounds. Within 3 weeks, she went down to 79 pounds because she couldn't eat. She had a flare-up. Going down to 79 pounds, she was considered anorexic. She was hospitalized because she had to be on IVs. She was pretty much on 13 medications. Once a year later, she was on 13 medications. It's a lot of medications. She started with 5, which leads to more side effects, so she got to 13. She turned 18, she went to a doctor, Dr. Grant, who got his degree at Harvard School of Medicine, and then he went over to, she went over to the hospital at UCLA, and he told her, I'm not supposed to tell you this, but he basically told her to try medical marijuana. So she did. And by trying that, she had a complete 360 turnaround. She was a new person. She was a person we never saw. She could eat. All of that. So in this speech, I'm going to argue why you guys should vote to pass House Number Bill H.R. 2306. The first thing I'll talk about is the inconsistency over the federal and state law, and by how not passing it, people who have who deal with medical can help benefit them. How by not passing it, it's not going to benefit them. Second, I will talk to you by what is H.R. 2306, and by passing it, how will it help benefit people who are dealing with diseases such as cancer and AIDS. And then lastly, I'll talk about how by passing the bill H.R. 2306, it will not lead to addiction. And Proposition 215 is a proposition for passing medical marijuana. In 1996, 16 states voted to pass it, one of them being California. So in 1996, we passed it, but as a federal government, they have overridden the power of us as a state. So even though as a state we're allowed to have medical marijuana, the federal government will pull you over, even if you have a card for medical marijuana, and they can still put you in jail for using it or possessing it, for selling it, for having your own plants, even though as a state we voted for it. So because medical marijuana patients, they're not really clear of what they can do, or can they possess it? Because under the state they can, but under federal government they're kind of concerned. They don't know because they're going to get in trouble for it. So even though people who are dealing with cancer, AIDS, Crohn's disease, like my cousin, all of those diseases that cause pain, they're not sure if they can use it because the federal government can override us. So by passing the law, it will give a clear understanding to patients of what they can do, how much can they possess, what can they do with it, can they drive with it, can they have it at their house, they don't know this yet because it hasn't gone to that level of understanding. Also, by not passing H.R. 2306, you're making people dealing with all of chemotherapy who can't eat. You're making them suffer and they can't eat because they're in pain. People like get out of surgery who have pain. They don't want to take a pill that's been kept filled with chemicals. Instead, they just want to do something natural, such as marijuana. It's a plant. It's something natural from the earth. It's not a bunch of chemicals that are in a lab and compounds into a pill. Which leads to my next point. By passing H.R. 2306, medical marijuana, patients who have medical marijuana who are dealing with pain can use it for relief. It helps people who have chemotherapy side effects or vomiting and nausea. People who smoke medical marijuana, it actually has a compound THC, which relaxes the body. People who have nausea, it makes them just relax so they're not so nauseous and they don't feel sick to their stomach like they have to from. People who also deal with chemotherapy and intestinal diseases such as Crohn's disease, it's hard for them to eat because they're in pain when they do eat because their stomach is inflamed. The compound THC also helps relaxes your stomach muscles in your body. By relaxing it, it makes people who are anorexic and, like I said, have stomach diseases, and lets them eat and it lets them feel that they don't have to be anorexic because of their diseases. They can't eat, so now they're capable of eating and get the nutrients that their body needs, which medical marijuana will help them have. H.R. 2306, basically by passing H.R. 2306, it's not legalizing marijuana, but it's removing it from the Controlled Substance 1 list, and because right now under the federal government it has a high abuse rate and also no medical use. which obviously it has medical use because there's many cases out there that are recorded for medical use. So by removing it from that list, basically it's giving the federal government, instead of the federal government having complete control, it gives the state the complete control, so medical marijuana patients can have a clear understanding of their medical use and what they can do. So it's not, by passing it, it's not legalizing marijuana. It's not saying you can drive and you can smoke medical marijuana. You can't go to work and go on a break and go smoke a bowl, smoke a joint, whatever you want to do. It's something you do in your own house. It's something like you're taking Vicodin or taking morphine, all of that. The next thing that I'm talking about is people are scared of passing HR 2306 because they believe it's going to lead to addiction. According to the U.S. Institute of Medicine, 1 out of every patient that has medical marijuana has a dependency for it, only 1 out of 10%. So that's basically, it's nothing compared to, as comparison, 3 out of every 10 patients smoking tobacco is addicted to it, and 4 out of every 10 patients with alcohol are addicted to that. People who, according to the Drug Administration, people who, the highest addicting drug is opium. And opium is the world's most prescribed drug for pain. So by legalizing medical marijuana, it gives people who are addicted to opium, which is the world's most addicting pain relief, it gives people away from that and into weed, marijuana, which isn't addicting. 1 out of every 10 people, which is way better than the world's most addicting drug, which is opium. So people who are addicted to that can, an alternative is medical marijuana, which isn't addicted. And also, according to the U.S. Institute of Medicine, by the age of 34, users that use medical marijuana find that they have no dependency for it after the age of 34. Another thing is opium, which comes from, which is morphine, which comes from the poppy seed and the plant of opium, is the world's most addicting drug, and it has a lot of side effects. There's many reports of people who overdose who have died from opium, where people who smoke medical marijuana, there's no case, you can search everywhere, there's no case of somebody has died from medical marijuana. People, they don't die from a natural plant. You can't die from medical marijuana. There is cases where you can die from smoke inhalation, which will happen from medical marijuana. According to the Drug Administration, to die from medical marijuana, you would have to smoke 1,500 pounds of medical marijuana in 15 minutes. And even then, it's reported that you would, that's like a car, that's like a Honda Civic full of medical marijuana. That's how much weed you'd have to smoke in 15 minutes to die from it. And even then, it's reported that you wouldn't die from medical marijuana, you would die from the smoke to smoke it. Because, like I said, you can't really die from a natural plant, it just comes from the earth. So in this speech, I informed you about 3 things. By House Bill HR 2306, by not passing it, you're making patients with illnesses suffer. And then by passing HR 2306, I informed you on the benefits of passing it. And lastly, I informed you that by passing HR 2306, it will not increase addiction. Hopefully when the bill comes around, please all consider people who are dealing with people who are sick, and consider their pain and maybe just consider passing it. Thank you.